Chapter 11 of the Professional English in Use. Medical Education 1. A. Medical Education in the UK. Medical education in the UK covers under undergraduate education, 4 or 5 years at the medical school, the section of the university responsible for medical education. A 2-year foundation program, which provides training for new doctors after graduation through a series of placements in different specialties. Postgraduate training, which doctors take to become GP or consultants, senior specialists, often delivered through colleges for different specialties, for example, the Royal College of Physicians. Physicians. Sorry, I got it. Continuing professional development. In the form of courses and seminars which doctors undertake throughout their working lives to get up to date. B. Extract from an undergraduate prospectus. The MBCHB Bachelor of Medicine Bachelor of Surgery is a 5-year undergraduate medical degree course. Most your learning takes place in small groups. The main components are core years 1 to 3, an integral program of clinical and scientist topics mainly presented through problem-based learning, where you work with others on a series of case problems. Students select modules. Student select modules allow you to choose from a menu of subjects such as sports, medicine, or even study a language as preparation for an overseas elective at a hospital attachment of your own choose between years 4 and 5. Vocational studies art and clinical skills. These components prepares you for the clinical skills required for contact with patients from year one of your courses. Through periods of practical training where you are attached to a hospital department or general practice. Clinical attachment years 4 and 5. A series of forward clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics, and gynecology, and general practice. C. As a student's view. Ellen, a medical student, describes her course. I'm just finishing. Ellen, a medical student, describes her course. I'm just finishing my first year of medicine. What I like about this course is what you it's that you're involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the courses is PBL. We have 2 hour sessions a week where they work in group of 8 to 10 solving clinical problems. We decide together how to tackle the problems, look up look at books and online sources, make notes and discuss the case together. It's a great way of learning and getting to know the other students in the past medical students at lectures with the whole class taking notes for lectures from 9 to 5, but now it's mainly group work. Although we do have some lectures and seminars where they work in small groups with a tutor, I like all of it, even the dissections. We get to cook of cadavers from the second month of the course. Sorry. So now it's time to translate. Okay. Again, 11, Educación Médica 1. Em, Educación médica en el Reino Unido. La educación médica en el Reino Unido cubre educación universitaria de 4 o 5 años en la Facultad de Medicina, la sección de universidad responsable de la educación médica en un programa básico de 2 años que proporciona formación a los nuevos médicos después de la graduación a través de una serie de prácticas en diferentes especialidades. Ver la unidad 12. Ver la unidad 12. eh, formación de posgrado para, para que los médicos realicen para convertirse en médicos de cabecera o especialistas senior, a menudo impartida a través de colegios de diferentes especialidades, por ejemplo, el Royal College of Physicians o el Colegio Royal de Médicos, ok, especialistas. Desarrollo profesional con desarrollo profesional continuo en forma de cursos y seminarios que los médicos realizan a lo largo de su vida laboral para mantenerse al día. B. Extracto de un prospecto de pregrado. El MBCH o licenciatura en medicina y licenciatura en cirugía es un curso de grado en medicina de 5 años. La mayor parte de su aprendizaje se lleva a cabo en grupos pequeños. Los componentes principales son el núcleo core, años, el año de 1 a 3, un programa integrado de temas clínicos y científicos presentados principalmente a través del aprendizaje basado en problemas ABP o PBL, donde se trabaja con otros de una serie de problemas de casos. Módulos seleccionados por el estudiante. Los módulos seleccionados por el estudiante te permiten elegir entre una variedad de asignaturas como medicina deportiva o incluso estudiar un idioma como preparación para una asignatura optativa en el extranjero. Una pasantía hospitalaria de tu elección entre los años 4 y 5. Estoy leyendo acá. Ok, continuamos. Estudios vocacionales y habilidades clínicas. Estudios vocacionales y habilidades clínicas. Este componente te prepara para las habilidades clínicas requeridas para el contacto con pacientes desde el primer año de tu curso, a través de periodos de formación y práctica en la que estarás adscrito a un departamento hospitalario o a una clínica de medicina general. Pasantías clínicas. Años 4 y 5. Una serie de pasantías clínicas de 4 semanas en medicina, cirugía, medicina psicológica, salud infantil, obstetricia y ginecología y medicina general. C. La opinión del estudiante o opinión del estudiante. Él, un estudiante de medicina, describe su curso. Ok. Y dice, estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que te involucras con los pacientes desde el principio. Incluso en nuestro primer año pasamos tiempo en el hospital. Gran parte del curso es ABP. Tenemos 2 sesiones de 2 horas a la semana en la que trabajamos en grupo de 8 a 10 personas resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema. Buscamos libros y fuentes en líneas. Tomamos notas y discutimos el caso juntos. Es una excelente manera de aprender y conocer a los demás estudiantes. En el pasado, los estudiantes de medicina tenían clases magistrales con toda la clase, tomando nota de los profesores de 9 a 5. Pero ahora es principalmente trabajo en grupo, aunque tenemos algunas clases magistrales y seminarios donde trabajamos en grupos pequeños con un tutor. Me gusta todo, incluso la disección. Podemos cortar cadáveres a partir del segundo curso. Ok. So we're gonna be reading the exercises and using English as always. Okay, let's start. Match these activities to the stage of medical education in the UK, given in A opposite. Uh, Dissecting cadavers, undergraduate, to keeping a love of surgical procedures observed and performed, postgraduate, to working for 4 months in accident and emergency to experience this specialty, foundation program, for taking a 4-week attachment in obstetrics and gynecology, undergraduate, 5. Taking an online course on recent developments in cardiovascular disease. Continuing professional development. 11.2. Complete the sentence. Look at B and C opposite to help you. 1. Just before their final year, students have the chance to take an elective in a hospital of their choice, anywhere in the world. To problem-based learning, contrasts with an approach where each subject is taught separately. 3. These days, lectures are often interactive with regular opportunities for the students to ask questions. 4. In clinical attachment, students learn how to treat and manage patients. For students selected, models can be a topic from outside medicine, such as for language, dissection of cadavers is an important part of the anatomy component. 7. The medical school at the University of Edinburgh is one of the oldest in the UK. 8. She's a consultant at the Royal, one of the leading pediatric hair specialists in the country. 9. The Royal College of Surgeons in Edinburgh dates from 1505. 10. We have a seminar each week where we discuss topics in a small group with our lecturer. 11.3. The last part of this chapter. Match each of these activities to one of the components of the undergraduate course. The script in B and C opposite. 1. Julie spent 6 weeks working in a small hospital in the Himalayas. Oversets elective. 2. A group of students discuss together the possible reason for abdominal pain after meals in an obese 44 years old male. Problem based learning. 3. A small group of students tries the pulmonary artery in a cadaver dissection. 4. Otto spends a month working in a pediatric ward of the local hospital. Clinical attachment. 5. Anne learns how to take blood from an elderly patient. Clinical skills. 6. Huma chooses to study travel medicine in his 4th year student select model. So that's all for this chapter. Thank you for your attention and see you next chapter. Bye.